I'm Dr. Sharath, Chief Consultant Plastic Surgeon at Arete Hospitals. Today I wish to speak to you about rhinoplasty. Rhinoplasty is correction of the nose, wherein there can be deviations of the nose, bony part or the cartilaginous part. The cartilaginous part, depending on the septal deviation, can cause breathing difficulties, and if there is an external deviation of the nasal bones, cartilaginous, which is causing a misshapen nose, that can be corrected. Childhood trauma can contribute to an abnormal shaped nose, and sometimes a growth spurt also results in a nose which may not be in line with their adolescence or younger age. Nose correction usually is undertaken after age of 17 when the form and growth and everything is complete. An evaluation of the nasal parts, including nasal bones and cartilages, has to be done by a plastic surgeon or an ENT surgeon. When external form and functional aspect is assessed, if there is a septal deviation which is contributing to the airway obstruction, that needs to be corrected along with a form correction of the nose. A CT scan of the nasal bones and the nasal structures will help in going forward with the planned care. A correction of this nose is undertaken with two methods: under general anesthesia or local anesthesia, and by an external approach or a closed rhinoplasty, which is an internal approach. Open rhinoplasty is done through columellar incision. Columella is the center part of the nose, which is seen from below, which is below the tip of the nose, and an incision 1/3 the distance from the base of the columella. The approach, the nasal skin is lifted up and correction of the cartilaginous or bony components is done. If bony components needs to be reduced, again osteotomy can be done. Osteotomy is cutting of the bones. It can be done externally, that is with tiny nicks at the junction of the nose with the face, lateral bones of the nose with the face, or an internal osteotomies, which is the nostril bones are cut from inside of the nose. A bony correction along with a cartilaginous correction, if there is a requirement, helps in achieving a satisfactory shape of the nose. A septal correction helps in breathing improvement, and sometimes the lateral walls of the nose and the septum, because of the crookedness, the space is less and breathing difficulty happens. So this correction helps in relieving that problem. The recovery component, if there is a bony correction, a external splint is put, and that needs to be in for 2 to 3 weeks, depending on individual surgeon's preferences. The duration might vary. External scar on the nose, if it's an open rhinoplasty in the columellar area, usually fades away, and longer the period from the surgery, the scar is very minimal or it effaces. The internal swelling and the external swelling usually take a little time, about 2 to 3 weeks, and the tip shape comes out into the final stages in about 6 months. A dorsal correction or a height correction manifests itself very easily post-surgically. So edema is what you call as something which masks the surgical results in the early few weeks, and a patient who has a rhinoplasty needs to be aware of this and have some patience in waiting for the final result. So a plastic surgery consultation prior to the procedure would help in planning their surgical requirements and post-operative outcome, which is more realistic.